Menopause is a biological event. Misinterpretation is the crisis. I'm Priya, and that quote from today's guest stopped me in my tracks. Here's what nobody tells you: menopause hits during your peak earning hours. It can derail careers, tank your income, and leave you feeling gaslit by the very doctors who should be helping you. And most workplaces, they are completely unprepared. Today on Empower Her, I'm sitting down with Shirley Weir, founder of Menopause Chicks and the brain behind Menopause.WORK. And she's been in the trenches of this conversation for over a decade. Today, we're talking about why the healthcare system is failing women and what an ideal experience would actually look like, how to cut through the noise of conflicting advice and make informed decisions about your body, the real financial cost of menopause, and why this is a retention strategy, economic imperative, and a human right. Script tips to help you advocate for yourself when doctors aren't listening, and why menopause literacy isn't just a women's issue, it's a business imperative. Whether you're navigating perimenopause, supporting someone who is, or leading a team, this conversation will change how you think about this transition. So let's dive in. Hi, welcome to Empower Her Podcast. My name is Priya. I'm your podcast host. So today I have a very special guest with me, Shirley Weir. She is an expert on menopause. Um, for over a decade, she has been working on making sure that this is a topic that is talked about more and change the conversation around women's midlife health. She's the founder of Menopause Chicks and Menopause.WORK. She's a speaker, educator, and I will hand it over to you to kind of, give our audience kind of an idea on what, made you go into this field and then the kind of work you've been doing so far.
Sure. Thank you, Priya, for inviting me. Menopause is my love language, so I love to talk about women's health and women's midlife health. And I also talk quite a bit about a lot of the misinterpretation around information that we may have received or may not have received, and how that has kind of led us to 2026 now, where women, for the most part, I don't think that this problem, even though I've been working on it personally for 13 years, is solved. And that problem is, it's a lack of dialogue.
Mhm.
So I love podcasts. So thank you for that and for doing this. But it's not just conversation, it's misinterpretation, misinformation, misunderstandings, um, banging up against a history of patriarchy, dismissal, disappointment with healthcare experiences. Sometimes I say systems there, but a system is really hard to be mad at, because you and I are part of the system. So I like to bring it down to, what can we do? What will happen as a result of this conversation today for your listeners?
Mhm.
That's really where I think the magic is in talking about menopause.
Yeah, that's something that you've mentioned that is really interesting is, misinformation, which is, whether it's because of social media or whether it's because we have so much access these days to different things. And now, like, AI is coming into that picture
Yeah.
as well. So I feel like this is definitely a very important topic that we're going to talk about today. So, starting with menopause and the conversation around menopause, something that you've mentioned before that I kind of had gone through when I was kind of doing my research was that it's a biological event, but misinterpretation, as you said, is the crisis right now. What was that moment that kind of made you realize that the conversation around menopause had to change?
Yeah, so I think what made me realize the conversation around menopause needs to change is the fact that few people, if we were to take your microphone and step outside right now and just ask the first few people on the street, tell me what menopause is or what it means to you, we'd get either a lot of puzzled faces or a lot of different answers. But probably the thread that would run through such an exercise would be it means women suffer.
Mm,
And women are not meant to suffer. Menopause, as you said, is a biological event. What it is it's the end of ovulation. So
mhm,
it's the end of our reproductive years. It's one day on the
mhm,
calendar, and it's
mhm,
the opposite end of a hormonal experience that begins in puberty when we begin to ovulate. So there's day one when the
mhm,
first egg is released, and there's the last day an egg is released. And that's really what menopause is.
mhm,
Now, you've already alluded to misinterpretation and we live in a world of AI. Um, Menopause is a social construct now where lots of people on the street or our peer, your peers, my peers, they probably think of menopause as something different other than the end of ovulation. They might think of it as the end of periods, which is true because a period is one of the indicators that we use to define menopause for most individuals, but not all.
mhm,
The magazines, the headlines, the SEO, they all really lean into this phrase called menopause symptoms. What are
mhm,
all the ways in which women suffer? And then to the next question is, how can we cure her, treat her, you know, um, help her in a medical setting? And some of that information is really appropriate
mhm,
and some of that information is really unnecessary. And I do feel
mhm,
like it's clogging up our
mhm,
ability to discern that information, whether it's on social media or AI or in our doctor's office, to be
mhm,
honest.
mhm.
Right. So yeah, it's this, and then it's all of a sudden it's something
Yeah.
much, much bigger, right?
Mhm, mhm. Yeah, I think that is kind of like the nuance around information, that
Yeah.
initially, years back, the problem at that time was people didn't have enough information, and now it's too much information because we have like so much information to consume. We're not really sure like what's relevant, what's not really relevant.
Yeah.
So I'm really glad that we're talking about this today.
Yeah, and
Um,
to that point, sorry, years ago, like years, way 200 years ago, 150 years ago, women didn't live far beyond menopause. So I think that that is really important to kind of lay the groundwork of this discussion is
mhm,
that our bodies were originally designed to give birth at 19 and 20, to
mhm.
start having babies then and to die at 51.
Oh
Now
wow.
we've progressed. I'm going to be 59 next month. Now we've progressed to a culture where we really truly expect to live beyond 85. Perhaps
Mhm,
most of us are all shooting for 100. And that's within the realm of possibility. But what hasn't caught up is how do we live to be 100 and still have a healthy brain, a healthy heart, healthy bones, and healthy genital urinary a
mhm,
system. So that's what's really drives me on a
mhm,
regular basis is we've got 3 to 5 decades to invest in and plan for.
mhm. Definitely. And then, can you give our audience about an idea what is Menopause Chicks and
Sure.
how did you get started with that?
Yeah. Well, Menopause Chicks is an online education community. So it's a place where I can do a lot of this interpreting and translating of quality evidence based information. For a lot of my members, it's a private online community on Facebook. And for a lot of my members, it's the health class that they never got. You know, for many of us growing up, if you were fortunate enough, you got a class on how to make a baby. And then you got another class on how not to make a baby, all the contraception choices. And that might have been the end of your learning, except maybe for your own lived experience. If you went on to be sexually active, you went on to have a family, and then you wake up one day and suddenly, you don't feel as good as you did. So that can be really confusing and challenging. So we try to just conquer that with quality evidence-based information. Um,
Mhm.
and how did I get here? Well, my goodness, I can answer that question in so many different ways. But my own story is not really that different from any of your listeners. I was in my late 30s, early 40s, an entrepreneur, two young kids, aging mother living with me, showing signs of dementia, burnt
Mhm.
out, not sleeping, pushing the envelope, getting up early so that I could work a ton before my
Mhm.
children woke up, doing all those things kind of almost, well, not almost. I was believing that I was Superwoman.
Mhm.
And
Mhm.
none of that experience was carving out time for me or
Mhm.
taking care of me.
Mhm.
And so I really felt like, oh, I don't feel well. This must be something like this must be something that I can point the finger at and get mad at and blame. I
Mhm.
know I'll blame perimenopause. I bet you it's that it. I'm going to go to my doctor. Well, my doctor looked at me at age 41 and was like, you're too young for menopause. The average age is 51.
Mhm.
And she didn't really have any tools in her toolkit to
Mhm.
support me.
Mhm.
She said I could go back on the birth control pill, I could take antidepressants, or I could take sleeping pills. And I was
Mhm.
like, oh, I was so disappointed. I didn't think that was going to be part of my journey. So that's how Menopause Chicks was born. And then kind of throughout that process, I've really been had a first row seat to a lot of other women's experiences, including I have permission to share the story of my daughter who's
Mhm.
22 and has
Mhm.
had her own hormone challenges with
Mhm.
PCOS. My
Mhm.
sister who reached menopause prematurely at age
Mhm.
36, and I get to
Mhm.
tell her story. And my
Mhm.
mother who was ignored, who had a lot of suffering in her later years. She's gone now, and was ignored or not offered the appropriate treatments, which is heartbreaking. And
Mhm.
so that motivates me every day to do this work for others as well.
Mhm. Mhm. Yeah, and I'm really glad that you're able to share those stories today because, again, listening to someone else sharing a story that resonates with you, like that's really empowering for a lot of women, and that's where kind of like my purpose is through
Yeah.
this podcast. So really glad to have you here to talk about those stories. Um, so talking about your own experience, or your daughters or anyone in your family, and then obviously you have a huge online community
I
of
do.
a lot of women that talk about their experiences. What would you say are the biggest misinterpretations about hormonal health or menopause?
Yeah, the biggest misinterpretation is that every symptom or every way a woman can suffer through her for her quality of life is related to menopause, and that's simply not true. So
Mm,
if one of the things that we could clarify today is understanding the role of progesterone and estrogen is fundamental to understanding your hormone journey.
mhm,
Estrogen is the hormone that's produced in the first half of our cycle, and it's responsible for developing an egg follicle, but it's also responsible for protecting our brains and our hearts and our bones and our vaginas. And it helps to keep everything juicy, including our skin and our eyes and our mouth. And I don't think that we like revere estrogen as sort of this amazing, fuel in our tanks. And then progesterone is the hormone that's responsible, it gets calming. It's responsible for our sleep and supporting our mood, and it regulates our bleeding, and it protects the lining of our uterus. So the reason that I love to share that is because if you have changes in your bleeding, let's say your period gets heavier, you can then go, oh, I remember Shirley said something about that might be related to progesterone. But if you are not sleeping, like let's say you have chronic insomnia disorder, it might be related to your age. It might be related to perimenopause because yes, sleep is something that can change. But having chronic insomnia disorder is not just part of being a woman, right? And so we have to realize that a lot of the other experiences that we have might be hormone adjacent and not all hormone related. And regardless of whether they're related to perimenopause, menopause, or something else, that we're not meant to suffer. So instead of just putting up with no sleep for a decade or more, and believe me, I know individuals who do that, what can we do? What's approved treatments? What are the things, it's not probably on the shelf at the big box store or even the pharmacy. It might require us to have a sit down conversation with ourselves, ideally a healthcare provider who can support us, and get really curious about what we can do. Because once we solve for sleep, a lot of the other things can be easier to tackle in our full lives too, right?
Exactly. Yeah, definitely. And then when, obviously you mentioned your story or even anyone in your family that has gone through different, hormonal health issues, let's talk a little bit about that.
Sure.
And yeah, if you want to like maybe start with your story and then we can kind of go into that as well. Yeah.
Yeah, so I had an easy reproductive life. I got pregnant easily. My periods were not a big deal until probably my mid 40s. What I really noticed was progesterone is the first hormone to decline. And so I did notice changes to my mood and changes to my sleep and a little bit of changes to bleeding, but nothing like some of the members that I work with who share stories with me. I was also iron deficient, and as I said, I was also burnt out and highly stressed, and just trying to run a full life as many of us do. My let's see, I'll talk about my daughter. My daughter is 22 years old. She has polycystic ovarian syndrome that is being managed. But when she was 17, she lost her period. And I'll be really honest with you. My first reaction was, oh, that's no big deal. I hear that happens to athletes all the time. And you're an athlete and, don't worry, it'll probably. And then I was like, oh, wait a second. You're not ovulating. This could impact your future fertility decision should you decide to want to have a baby someday. We need to pull back the layers of the onion and investigate. So great health team, we're very privileged, great health team, and it's under control. But it was that opportunity that I had to learn about hormone health that really, I hopefully has helped her. My sister is 10 years older than I am. So she's turning 70 this year, actually. She's 10 and a half years older than I am. And she reached menopause when she was 36. So that was the early 90s. And, none of the things that we were talking about earlier, no social media, no AI. Her doctor admitted to not knowing anything.
Oh, wow.
And so she had to go door knocking and visit as many healthcare professionals as she could because she knew from her doctor and she knew intuitively that the decisions she was making at 36 was going to impact her future health, and particularly bone health. So I don't know if you know or not, but when we lose estrogen at menopause, our bone density decreases and we become more risk averse for fractures, which can have, devastating impacts. We don't think a lot about bone health and menopause. It's always like all about the hot flash, right? And breaking a bone could ruin someone's life. Like if you
Yeah.
fall and break a hip or a shoulder or something like that. So the good news is she showed me what it really means to be your own best health advocate. And I use that phrase a lot because I think, wow, she did the homework. She made the decision that was right for her. Then she got her GP to kind of support her in that. But it was really good learning, even though it's like now a few decades ago, and she's a healthy senior enjoying life.
That's
My
amazing.
mother, yeah, it is an amazing story. My mother passed away when she was 80, and before her death, she was being treated for dementia with medications to potentially slow down dementia. Now, dementia can never really truly be diagnosed until death. So it's a suspicious diagnosis if someone is showing signs of dementia. So prior to that, or alongside her healthcare experience, she suffered greatly from dry vagina, dry eyes, chronic dry mouth, oral problems. All of those things indicate loss of estrogen. Happens at menopause, right? So remember, we talked about the role of estrogen. She was never treated appropriately for that. And reoccurring UTIs, or urinary tract infections, is part of that dryness because the urethra gets shorter and smaller when it doesn't have estrogen, makes it more susceptible to infection. In older people, I'm trying to draw a line here. In older people, urinary tract infections can show up differently than the traditional symptoms we may know of. So a urinary tract infection can happen to anyone at any age and stage, but it might show up as frequent urination or pain with peeing, that kind of thing. When you're older, sometimes those symptoms don't exist, but you might show forgetfulness and memory lapses, and then be put on a train for dementia diagnosis, and your UTIs aren't treated. And the moral of this story is that both the Canadian and the American Urological Associations recommend preventing UTIs with vaginal estrogen. And I am on a mission to share that with everyone because I want you, if you're listening, to make sure that you, your mother, your grandmother know this information.
Definitely, yeah. I had no idea about especially the UTI symptoms part, because everybody thinks it's the classic UTI symptoms of frequent urination, but all those things, yeah, I can imagine a lot of women being maybe misdiagnosed, or as you said, like put
Or
on a
underdiagnosed, yeah.
yeah, definitely. So yeah, but again, thank you for sharing that information, because I'm definitely
Part of my
sure that
mission.
handy. Yeah, definitely. Um, and then I think all the information that we're talking about today, where do you think the gap is? Why do you think we are, I wouldn't say bad at talking about menopause, but there's definitely something lacking, whether it's culturally or medically. But is there a root cause that you've kind of observed in when you're talking to different women, or to even men as well?
Yeah, so it's definitely, there's definitely barriers culturally, as you mentioned. Medically, the biggest barrier is dismissal and disappointment. a lot of women's health concerns are dismissed inappropriately.
Mm-hmm.
And I don't know, like I can think back to even being a very young girl or teen and being almost afraid to tell anyone if I ever had a stomach ache.
Mm-hmm.
I don't know if you can relate to this or not, but I can remember like maybe it was a digestive stomach ache or maybe it was a nervous stomach ache, but I never wanted to tell anyone I had a tummy ache because their first thing they're going to ask me is, "Oh, is it her period?"
Mm-hmm.
Right? And like we make all of these boys don't do that. Boys don't have to deal with that. If they have a stomach ache, they can just
Mm-hmm.
have a stomach ache and then seek appropriate treatment. But we are kind of like weaving all of these narratives through our head and maybe keeping a lot of things silent. I think that carries with us
Mm-hmm.
through adulthood, and whatever the choices that we make, whether it's parenthood, pregnancy, parenthood. And then when we get to perimenopause, there's a lot of built up like shame and stigma
Mm-hmm.
that we may not even realize or may not have realized before the dawn of podcasts, right? So now the conversation is being cracked open a little bit more. But if you listen to this podcast and you think, oh, okay, now I'm going to go and see my doctor, I want to talk about, A, B, and C. And first of all, do you have a doctor? Because in Canada, that's a challenge
Mm-hmm.
for millions of people.
Mm-hmm.
Secondly, that appointment's 10 minutes long,
Mm-hmm.
and we've already been talking for half an hour.
Yeah.
Okay, right? So you have to be really good at preparing for that
Mm-hmm.
conversation and knowing how to be succinct and how to present your story and understand what your values are in terms of what
Mm-hmm.
you want for treatment or what would be appropriate for
Mm-hmm.
you.
Mm-hmm.
But yeah, there is a study that was published here in British Columbia a few years ago now, but it's called the inherwords.ca study.
Mm-hmm.
And what that study showed us is that over half of women, we leave our health appointments feeling dismissed or disappointed. And that number is significantly higher for
Mm-hmm.
Indigenous women and women of color.
Mm-hmm.
We're already
Mm-hmm.
feeling some marginalization by the healthcare community or the healthcare system.
Mm-hmm. Definitely. Yeah. I would say that, especially when it comes to, time that doctors are spending with patients, that's very limited. That is, a reality today. So I think that was a really significant point here, especially because even I feel like when you go to a doctor, it's really important to see how you present your symptoms as well, or how you talk about whatever you're going through, because if in that limited time you're not able to explain that properly, again, it can be, as you said, underdiagnosed or misdiagnosed. So I think I just wanted to like emphasize on that point because I think that's something that is I have seen like personally or even with my family members where
Yeah.
that has happened. So
I
yeah.
created a tool that we're trying to combat that with. Would you
Yeah.
like to know what it is?
No.
Would you like to know what it is?
Yeah, for sure.
Yeah. So, because of this dismissal and disappointment rate, which is huge, I create script tips for women. And you
Okay.
can customize those script tips to work for your own personality and your relationship with your doctor. But when we began this research initiative, the one piece of that conversation that was missing for almost all my members was nobody was explaining the impact of their
Mm,
symptoms. So
mm,
it's easy for most of us to show up in our doctor's office and say, I'm feeling, this, and this, right? And give the
mhm,
list.
mhm,
But we were missing the part of the communication that eliminates dismissal and disappointment. Like, you
mm,
get it out. And that
mhm,
is telling someone how it impacts you, what it means for you. So if I said to you, I didn't sleep well last night,
mhm,
you might be like, oh yeah, Shirley, join the club. Nobody sleeps. Everyone's sleep deprived, right? Suck it
Mhm.
up, buttercup, right? That could be your initial thought.
Mhm.
If I said to you, Priya, I didn't sleep well last night, and it's really impacting my ability to care for my aging parents today. I was supposed to
Mhm.
take care of them. I was supposed to do this, and I wasn't able to. You'd be like, oh,
Mhm.
clearly there's an issue here, Shirley, that needs immediate attention, right? And
Mhm.
it really kind of changes the dynamic of those conversations.
Oh yeah, I'm really glad that you mentioned that. Okay, so we will put that in the description so that
Sure.
people who need that, they can access that as well. Because again, as I said, that is a really important detail here. So I'm glad that you mentioned script tips. Um, and then when it comes to the healthcare system, whether it's perimenopause, whether it's menopause, what would you say would be like an ideal experience for someone who is going in there for the first time?
Hmm. I love that question. I think, if my shortest answer would be the ideal scenario is for every woman to walk into a healthcare appointment feeling informed and confident.
Hmm.
And the analogy that I use a lot, I don't know if it lands for everyone, but if you and I were going out for dinner tonight and you suggested the restaurant, there's a really good chance that I would look up the restaurant online before I go and just kind of glance at the menu if they have one posted and have just a general expectation of what I was
Hmm.
walking into. We
Hmm.
need to do the same thing for our healthcare. We
Hmm.
cannot continue to show up with no preparation and
Hmm.
expect a positive health outcome in
Hmm.
8 or 9 minutes.
Hmm.
It's not happening.
Hmm.
So, being informed and confident, maybe being prepared with script tips, and ideally, even having an understanding of what's on the menu. I would
Hmm.
love to see healthcare conversations become more of a team, like a partnership, where
Hmm.
I'm saying to my doctor, look, I understand there are 3 available treatments.
Hmm.
But I would like to ask you, can you help me decide which one would be right for me?
Hmm. Hmm. Definitely. Hmm. Um, how do you feel about, when it comes to going into the doctor's office as well? I've heard from a lot of women as well. The other part that they kind of struggle with also is, just reassurance and, being empathetic as well. But what have you heard from, people around you about that?
That's a tough one. I mean, I can hypothesize. I think that it's a good time for all of us to be reminded that doctors are human, and as a result of that, every experience is going to be unique. It's
Hmm.
going to be based on their lived experience, their education, their focus of expertise in their practice, which can change, right? Like, you know,
Hmm.
maybe you're seeing a doctor who has a waiting room full of babies and you're walking in there as a 54-year-old woman. It's a different part of their day. They haven't been focusing on
Hmm.
your health all day, so we have to like kind of have compassion for that.
Hmm.
I think I want to say this. um, I think that if we are looking for validation, for empathy, we have to broaden our circle.
Hmm.
Our doctors have limited tools in their toolkit.
Hmm.
They have the ability to refer us on to someone. They have the ability to write us a prescription. They have the ability to order tests, to arrange for screenings. But probably empathy and validation is going to be hit or miss. And I think as consumers of healthcare, we have to
Hmm.
be okay with that.
Hmm. Hmm. Yeah, because yeah, from the conversations I've heard, It's basically because obviously, the doctors, or, as you said, the healthcare system is so overwhelmed. There is definitely very limited toolkits. So, um, yeah, I think that
You probably
is,
didn't take a course in compassion.
yeah.
Like medical schools graduate doctors based on, you want them to have gotten 99 on their whatever, their
Yeah.
science courses to get into medical school, but it's
Mm.
not based on compassion.
Yeah, it's not really, you're not being scored on, your empathy or,
No,
bedside manner, that kind of
no.
a thing. Yeah.
Maybe
Yeah.
somebody's going to correct me on that and say, "Oh, sure it is." And of course, we have there are some amazing healthcare professionals in this country and around the world, and we can't ignore that. It's not all bad, but whenever you put two people together, there's a chemistry, and sometimes that chemistry sinks, and sometimes it doesn't. So,
Yeah, exactly. And as you said, they're human beings. So
yeah,
at the end of the day, it's two human beings
right.
interacting with each
That's right.
other. So yeah, and that's where I think the community part comes in. And that's why it's really important for you to, maybe become a part of a community where, maybe, as you said, you can get those things from, other circles in your
Yeah,
life. Um, and when it comes to, different advice, so I think this was really important to talk about, because this has been like my own lived experience so far. Is I'm glad that we're having, these conversations, but there's so much information out there, and there's so much conflicting advice that it's confusing.
yeah,
For example, we are talking a lot about hormone therapy
yeah.
these days, right? And then I remember a few years back, there was like a lot of suspicion around hormone therapy. People were not really sure about it. They were like, we are not sure if it's effective, or, it has side effects, those kind of things. And, it was kind of avoided at that point. Now, I remember some time back, I started hearing more about it, and people were like being encouraged to take hormone therapy, and they were like, no, it's safe. And then now I'm hearing back again that no, maybe it's not that safe.
Oh,
So
really?
yeah, so that's why I'm kind of like, there's a lot of conflicting advice out there, and this is just an example. But like, how would you think, our audience should go about it, to cut through kind of like this noise and then make informed decisions around their health?
Two ways. One is go back to what we were talking about just a few minutes ago, rewind. Learn the roles and responsibilities of your hormones when cycles are regular so that you can be in the best possible position to make informed health decisions for yourself when cycles are no longer regular. On average, women north of 50 have to live for another 4 to 5 decades without the same hormone production that they had during their reproductive years. That has significant influence on our heart, brain, bone, and genital urinary health.
Hmm.
It is not my job ever to tell anyone to take menopause hormone therapy.
Hmm.
It is my job as the founder and leader of Menopause Chicks to convince everyone to go and have a curious, investigative conversation with their health team about what the potential benefits might be for them.
Hmm.
And the reason for that is because I don't want any of your listeners to wake up on their 60th or 70th birthday, with chronic urinary tract infections and say, well, no one told me that I could have used vaginal estrogen. It's approved, it's safe, everyone needs it. And it would support my quality of life. And I don't
Mhm.
want anyone on their 70th or 80th birthday to wake up and say, oh, I just fell and broke my arm, and my doctor says like I have like next to no bone density, and no one told me that that's
Mhm.
related to estrogen. So if we can back up the education to an earlier age, I think it really makes us feel that informed and empowered, or confidence that we mentioned, so that if you choose not to take hormone therapy, you did it from a place that was evidence based
Mhm.
and information rich, that was validated by the research that we know and also the common sense, right?
Mhm. 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 Definitely. Um, and this is going to be a little bit of a pivot, but I also wanted to kind of go into, menopause.work. That's
Sure.
another part also that you are doing a lot of work for. Can you explain our audience what it is and what's the kind of work that you're doing for menopause?
Yeah, menopause.work is just, referencing that I do a lot of education with people in the workforce. Workplaces have stepped up, especially over the last 2 to 3 years, in terms of bringing menopause education to the workforce. And I love it. And the reason I love it is because the workplace is an excellent place to reach large numbers of people at once. So, I do a lot of one-to-one work. This is like one to many, which is amazing. But more than that, the workplace is such a great educational classroom, and it allows us to reach all genders, all ages, and all stages at the same time. And
Mhm.
then thirdly, along that, it allows us to capture the attention of leaders in the workplace. And I believe a leader can be in any position, but decision makers in an organization need to understand that their workforce, their employees, may be sleep deprived, right? And they're not lazy. They're not, just unproductive.
Mhm.
They also need to maybe understand that the gender relationship, right? That women are going to be working beyond, the traditional retirement age. I think we're all, kind of aspiring to what our second or third or more career is going to look like. And we want to do that with quality of life.
Mhm.
And so, if an employer can play a role in terms of supporting, pointing, navigating, being a conduit to access to healthcare,
Mhm.
that's brilliant.
Absolutely.
And that hasn't always existed. So, I'm really proud of it.
Yeah, yeah, definitely. Yeah, and I'm glad that, I'm seeing more of like these workplace conversations happening now. Um when it comes to organizations or leaders, that still might think that, these kind of conversations are kind of like a nice to have, but not really necessary. Or they are just kind of avoiding or ignoring that for now. How would you have like a conversation with them, to kind of combat that um, belief, I guess?
Well, understanding what their triggers might be. I don't know if that's the right word or not. I don't always lead with this piece, but
Mm-hmm.
we have research now that shows the economic impact of
Mm-hmm.
supporting women as they're navigating midlife,
Mm-hmm.
and the economic impact of unmet symptoms related to menopause is over $3.5 billion in Canada alone. And
Mm-hmm.
so it really, when you do put a dollar sign on it that's that large, it's hard to ignore. And
Mm-hmm.
for me, if that opens up a dialogue or an education opportunity within a certain organization, then it allows me to have that conversation about, insomnia, for example.
Mm-hmm.
And it allows corporations and leaders to play a role not just within their own company, but within society at large. It might change where they donate money to research or to
Mhm.
not for profit, or it might change, the fact that 1 in 11 Canadians is living with insomnia. That means that when your employees are driving home tonight, every 11th car they meet on the highway is being driven by someone who has insomnia. Maybe
Mhm.
if we rallied around that, we would have a much healthier workforce.
Mhm.
So, it's
Mhm.
kind of euphoric, but you can start to plant these seeds. And if menopause is what opens the door for that
Mhm.
conversation, I'm all for it.
Amazing. What could be like a few examples of menopause friendly policies at a workplace?
I am adverse to the word policy
No.
when it's in the same sentence as menopause. And I'll
Mhm.
tell you why.
Mhm.
My husband is a counselor in a middle school,
Mm.
so grade 6, 7, 8.
Mhm.
And I asked him years ago, I said, "What is your puberty policy at school?" And he
Mhm.
said, "Puberty policy? What do you mean? We don't
Mhm.
have a policy
Mhm.
around puberty." And I was like, "Oh, yeah, okay, that makes sense." And he said, "All we do is foster an environment where accommodation and flexibility and moral support is, we hold children up as they're navigating growth and life." And I was like, exactly. So
Mm.
I'm not convinced that
Mhm.
companies need menopause policies,
Mhm.
which can get so misinterpreted, Priya. It can be like,
That's
oh, she has to take a day off because, she's
mhm.
52 now. I'm like, no, that's
Mhm.
not what we're saying. We're just saying support her health,
Mhm.
be accommodating, be
Mhm.
flexible if you can, be
Mhm.
understanding and compassionate, and support education. That's it.
Yeah,
No policy
exactly.
required for that. It's a
Yeah,
more
that's true.
more of a cultural, more of an organizational cultural thing.
Yeah, that makes a lot more sense now. Yeah, because yeah, even though your intentions might be good,
Yeah.
I still see some critical kind of point of views on some of these things. Especially, I see a lot of organizations now having like a period leave for women,
Yes. Yes.
and I've heard like critical point of views on that because it's, I guess, a policy
Yeah.
per se. So maybe that kind of like rubs off people in the wrong way. So I can understand where you're coming from. Yeah, yeah,
Again, like, you know, if you menstruate, if you bleed, and you have a workplace that is accommodating and flexible to your own unique employee needs, that's a good health outcome.
yeah. Yeah, exactly. Yeah, that's true. Okay, and um, when it comes to, I think you mentioned before about menopause and going through it yourself as an entrepreneur.
Mhm.
Um, how can someone who's also, in the same position, who's you know, woman entrepreneur who's like trying to hustle, navigate life, how can they protect their careers, businesses, and income during this transition?
I love that question. No one's ever asked me that before. And when one of your listeners comes up with the answer, will they please phone me first?
That's true. That is true. Please do that.
That's my first that's my first knee jerk response to that. I think as you were asking the question, I was thinking, oh, um, be kinder to yourself.
Mhm.
Um, don't give away everything because you need to invest in you. And thirdly, you deserve to feel amazing. Like,
Mhm.
we sometimes forget that being a woman does not mean symptoms and suffering,
Mhm.
right? It means
Mhm.
that we deserve to feel amazing, no matter what our job is, whether we're an entrepreneur or not. And we're so good at putting other people at the top of the to-do list. So one of the reminders I have for everyone in my community is put your own name at the top of the to-do list. There will be an ROI on that investment.
The other part that I also wanted to kind of touch on, and I just wanted to see what your perspective is, because I don't think I've seen anyone kind of like connect these dots before, but I wanted to kind of explore this idea with you is, yeah, menopause, this transition, how does this affect, any woman that is going through that? Um, when it comes to financial aspects of their life. And I'll explain why I'm kind of asking that, because I also discuss, about financial literacy or education
Mhm.
for women in this podcast. And, as I'm talking about it with different people, I've been noticing a lot of things contribute to your financial aspect in life, and especially when it comes to women, there's so many things that contribute to wage gap or things like that. So just wanted to see what have you kind of observed in that area. What are your thoughts on that?
Another excellent question. Thank you so much. I think specifically as it relates to women's health, um, there's a price tag attached to women's health care. And as we were discussing earlier, we can't always get everything that we need from our primary care provider, especially if we don't have a primary care provider. But we, as a culture and society, on top of the issues that you're raising, such as wage gap and inequity, there's an inequity in what it costs us to stay well.
That's true. Yeah.
And I've never seen a headline about that
Mm,
yet.
mhm,
So that's really important. And within that line item, you would then break out, what might be covered by our provincial health care, what might, an entrepreneur, to your previous question, have to pay out of pocket if she doesn't have employer health benefits. What does it actually cost a woman over 10 or 40 years of
mhm,
the second half of her life to just feel well? So
mhm.
I'm almost answering your question with more questions,
Yeah.
but I would love to highlight
Mhm.
that discussion because that is amazing, absolutely amazing,
Yeah.
and brilliant of you to ask.
Yeah, definitely. And I mean, that's where the conversation begins, is with questions,
Yes,
and us, questioning everything. And yeah, like just as you were talking, I was thinking about, oh, when it comes to insurance, like, does your insurance include menopause or hormone health related? You
some
know,
does, some doesn't. Yeah,
yeah, does it cover that? But maybe that's something that women should be looking at, if you're maybe thinking of buying maybe private health insurance, maybe taking a look at that as well. So
yeah.
those kind of things. Yeah, yeah,
For
definitely.
sure. And then if we all had a crystal ball, which we don't, right? We don't know how long we're going to live.
Mm,
And this is a major concern, I believe, for women especially, because we continue to outlive men. I believe the statistic is that, on average by 5 or 6 years. But currently, baby boomers who are entering those decades right now are entering those decades with higher rates of heart disease, dementia, incontinence, and osteoporosis.
mm,
And so the cost of care for us by the time we get to that age, and I'm way closer than you are, is could be astronomical, right? Because things have changed so much. We don't have sort of this guarantee that, oh, there will be a system that will take care of us when we get there, which makes it more imperative to bring it back to, the today conversation that we're having for your listeners, or what you might have, education from your employer, is what can you do to invest now in
mhm.
prevention?
Definitely. Um, and then when it comes to, kind of end of this conversation, what gives you hope when it comes to menopause conversation, maybe the next 5 to 10 years?
You.
Thank you.
I have hope. Whenever I get invited to chat with smart, savvy women like you, I how it gives me hope. I have hope when I hear my daughter, talking on TikTok about the fact that she had to leave work early because she bled through her jeans. And then
Mm,
she chose to share that with her followers on TikTok. And
mm,
not because it's sensational, right? Not because it's like, viewer worthy. It's because it's absolutely giving all of us permission
mm.
to have that conversation because it happens to everyone. And
Exactly.
I love that, that's not normalize suffering. I don't want to normalize suffering, but I
Mm,
do want to normalize the experiences that we all go through because the more we talk about it, then we can be hopeful in that there is a solution that's going to be right for us.
mhm. Definitely. Thank you so much for having this conversation with me. I'm so glad that you came on to this podcast, and I definitely want to continue having these conversations. And I hope people who have heard this podcast, they can learn more about, the menopause conversation with menopause chicks, or, script tips, as you mentioned, and
Right.
use those resources. And it's going to help out so many people. So, again, I feel empowered, and I feel hopeful, after having this conversation with you and the work that you've been doing. So it
Thank
really
you.
inspires a lot of us. So continue doing the work that you're doing.
I will.
And yeah, again, thank you so much for doing this work.
Thank
And
you so much for having me.
yeah, yeah. And we'll definitely would love to have you again on the podcast to continue having this conversation. But until then, all the best with the work, and see you soon.
Okay, thank you.